Thank you, my dear Rashida. And I will continue with the clinical manifestation and the diagnostic test for the multiple myeloma. For the clinical manifestation, patient will symptom of bone disease, typically persistent and unexplained breakage. Sometimes, patient will end up till 10% of pain score. And it also impact the renal function. Patient will face with anemia, typically pneumochromic, pneumocytic, less frequently leukopenia and thrombocytopenia. Patient also will face with the hypercalcemia and the hyperviscosity. Hyperviscosity is caused by the increasing of the serum immunoglobulin in the cell. And then patient also will face with the recurrent or persistent bacterial infection. There is a figure of the healthy bone and the multiple myeloma of the bone marrow that we can see. And we continue with the clinical manifestation. Patient also will have a symptom suggestive of spinal cord of the nerve root compression. Patient also will feature suggestive amyloidosis, raised erythrocyte sedimentation rate, weakness and fatigue, and also weight loss. For the diagnostic test, the doctor will do a certain diagnostic if the patient show too much calcium in the blood, and then patient also have anemia and a kidney problem, such as blood urea nitrogen and creatinine. And then the doctor will also do a bone marrow biopsy to check the number of plasma cells. Here is the figure that is abnormal multiple myeloma. And then for the imaging study, there is a skeletal survey lytic lesion easily seen in skull. CT, MRI, and PET are used in plasmacytomas. Bone are soft tissue deposits. And then the system maybe picks up bone diagnostic missed on the skeletal survey. And last one is a MRI spine that may show imminent compression or collapse. That's all, and my friend will continue with others.
Thank you, my friend Hasila binti Salihan. I will continue with the treatment. Usually, if asymptomatic, the doctor may choose to watch patient closely rather than start the treatment right away. If symptomatic, the doctor will work to come up with a treatment plan. It will aim to improve quality of life by easing the symptoms and helping the patient to get good nutrition. People who are considered high risk might want to look into a clinical trial or for an existing or new treatment. The treatment, medication, which drug your doctor chooses depends on your age and how aggressive your cancer is. Chemotherapy. Chemo drugs are most often used in combination. The ones that treat multiple myeloma are bendamustine, cyclophosphamide, doxorubicin, etoposide, liposomal doxorubicin, methylene, and vincristine. Some of these medication are from the overseas. And then we continue with the corticosteroid. This drug can help other treatment work. When getting chemotherapy, the doctor might prescribe dexamethasone or prednisolone to ease the side effect. Targeted therapies. This medication target proteins, genes, or tissue and prevent cancer from growing. Immunomodulatory drugs to strengthen immune cell to attack cancer cell. It also helps to starve the myeloma cell, or in other words, to suppress the myeloma cell in your bone marrow by preventing new blood from forming, such as lenalidomide, pomalidomide, and thalidomide. monoclonal antibodies to help immune system spot and destroy myeloma cell. The doctor called this immunotherapy daratumumab, elotuzumab. And then interferon, bone marrow cell and some white blood cells release this hormone-like substance. When it's used as a drug, it can slow the growth of myeloma cells. You might take interferon to help keep myeloma that's been successfully treated in remission. And then we continue with nursing management. My friend, let's see.
Thank you, Ms. Anira. And now we continue about nursing management. As we know, we have a 6th goal. The number 1 is reducing pain, preventing pathological fractures, maintaining hydration and prevention of infections, monitoring for signs of complication, and the last one is education the patient and family members. For the nursing diagnosis, number 1, pain related to osteoclast activities or due to disease progressions. A. Assess the level of pain using the pain score to determine what type of the analgesic required. As a staff nurse, we use a pain score chart in the BKJ number 14. Can anybody share with me what type, what the score to show the patient having a pain? Score number what? 9. Number 9, thank you. And then when we look about the pain, and we can continue the treatment. And then B, monitor vital sign for hourly or regularly as baseline and to know the effectiveness of treatment being given. When we take in the blood pressure, BP, we look about the uptrend, and it shows that our patient in the pain situation. Okay? And C, advise patient to complete rest in the bed and lessen the activity, helping patient in their activity or daily living or ADL, consult the doctor while formulating pain management plan, and administrate the other analgesic such as IM Botrel, Tacbotrel, Tetramal, and maybe IM morphine if needed. And the last one is NSAID, can also be used with opiate analgesic for severe pain. And we continue for nursing management number 2, risk for infection related to altered immunological function of body. A. Practice strict hand washing when handle the patient. We're talking about 5 moments of hand hygiene. B. Aseptic technique should be followed in every strike procedure. C. Patient should be kept in isolated room if possible, and if not, then limit the visitor with any type of infection. And we're talking about reverse isolations. And D. Avoid going to crowded or dusty area. And E. Mopping should be done in the room instead of brooming. F. Proper care of any extraneous device. And the last one, please remember, when or if your patient have a CBD, please take care of the CBD, because in patient safety goal Kementerian Kesihatan Malaysia number 14, no more cases for related with the CBD infections. Okay, this is our references. Any question from the floor?
No.
If no, with that, I thank you.